Seen myself or one of my teammates here at Cohen Health and Performance for rehab after an injury such as a tendinopathy or after surgery, you have probably had isometric drills incorporated into your rehabilitation process. Isometric exercises are exercises that are performed when our body is not moving. Our muscles are not lengthening, they are not shortening, they are working to hold our body in a given position. And these can be pretty tough, but the nice part is they're not very strenuous to the muscles, to the tendons, to the injury that might be bringing somebody in to see us. This is a great entry level drill to perform as our body gets back into being able to move and the injured tissues get back into being able to work a little bit. Of course, these exercises should only be performed if they're safe and appropriate for the nature of the injury that's bringing you in to see us. Most commonly, soft tissue injuries, such as, let's say, a patella tendon injury in the knee or other soft tissues throughout the body. Now, there are several different benefits to being able to perform isometric exercises, and one of the main ones to start with is they actually have been proven to reduce the pain sensitivity of the injury that might be bringing you in to see us in the first place. Also, when we cannot perform other versions of exercise, these exercises are great to incorporate to be able to reduce any loss of muscle strength. And one thing to keep in mind is that the body will be strong in the range of motion that the exercise is performed in. So we want to be mindful of that if we are an athlete or somebody who does pretty high level movements. We want to make sure that we're able to eventually train these isometric drills in joint angles that might be more specific to the exercise that you or to the sport that you are going to be getting back to performing. So let's say you are a gymnast. Well, if you're a gymnast, you are going to have to be able to perform these isometric exercises in greater degrees of bend and flexibility and positions than maybe a football player might. Beyond pain sensitization and muscle strengthening specific to the range of motion that we're training in a given isometric drill and reducing any potential muscle loss, isometrics also help to increase joint stiffness, which is incredibly important as we rehabilitate injuries such as an Achilles or calf injury as an example. So here is my colleague Dr. Kat demonstrating a couple of examples of drills that we may incorporate early on into somebody's rehabilitation process as they're starting to get into a little bit more exercise, and we can start easing them into the higher level or towards the higher level drills they ultimately want to be able to perform. So the first one here is a wall sit variation, and you'll notice she is high up on her toes, so she is strengthening the calf and the Achilles in a shortened position. And also as a nice added benefit, she's getting a little bit of loading through the patellar and the quad tendons in the knees as well. Then after performing that, we could do this in the same day, or if it's a little early on and maybe the tendon or the Achilles tendon or the calf is a little sensitive, we'll have to do it on a different day. We can go to the split squat variation, where again, we are strengthening this calf and this Achilles tendon in a shortened position with some continued loading through the knees themselves. It's also working on some nice foot and ankle stiffness as well at the same time, which we need in order to run, cut, and move very effectively. Now, isometric drills ultimately are most beneficial when performed with dynamic drills. Those are the typical exercises you often think of where we are, lengthening and shortening muscles in a variety of different positions, your more traditional gym-based exercises. Now, this is part of an overall rehab plan. So if you're somebody out there watching this, you have a soft tissue injury such as a tendonitis or a tendinopathy, whether it be a calf strain, Achilles strain, maybe you injured your knee or your quad, or maybe an upper body injury such as a pec strain, bicep strain, we would love to be able to help you design a protocol that you can do on your own to facilitate the soft tissue healing that you ultimately need to get back onto the field and into the things that you love as soon as possible. If that is something that you're interested in, contact us. We would love to be able to help you.